Please note that everything I do for this bookmark video is done via our demo set, so there's no PHI being revealed during this lesson. For this bookmark, you're going to be using Salient Interactive Miner, or SIM for short. You're using SIM to answer this question because it allows us to dig deeper into the data in order to find the result that you're looking for. This tutorial is meant to be used with the risk versus claim payment amount handout that can be found in Salient University. Begin by opening up your Bookmarks and Storyboards panel. Look under the Global folder for the Risk subfolder, and you'll see the white and red bookmark icon for Risk Category Analysis. Use this bookmark to identify the top chronic conditions within your patient population. In the context, you can see that you're filtered to only look at historically attributed beneficiaries, excluding those who opted out of data sharing. You're looking at claims for the last complete 4 quarters compared to the year prior and counting the total diagnoses count for both time periods. The diagnoses are grouped by risk category. Start by sorting the diagnoses count for this time period. That's the most recent complete 4 quarters. This will show you what the top risk categories are in your population. You can even use your mix pointer to insert the percent of total. In this demo ACO, you can see that almost 84% of their diagnoses are in the no risk category. While many of your population may have no-risk diagnoses claims throughout the year, a review of their records to find if there were any more specifically accurate diagnoses or diagnoses that make note of complications that arose could lead to more accurate coding for that beneficiary. Consider implementing chronic care management programs around these top conditions. Another possible use for this bookmark is to apply the delta on the diagnosis count to view the percent change from last time frame to this time frame. Sort the percent change to identify which risk categories have had a drop in diagnosis counts that shouldn't necessarily decrease, such as chronic conditions and amputations. I hope this bookmark video tutorial has been helpful to you. Through our Salient University, you'll find many video and handout tutorials designed to teach you how to get the most out of the Salient solution. Thank you, and as always, if you have further questions, please don't hesitate to email us at healthcaresupport@salient.com.